Teenage pregnancies continue to be a challenge in Uganda, especially after the COVID-19 period. With schools being closed and students being idle at the time, there were high numbers of teenage pregnancies that continued to spiral even after normalization. Large numbers of students, especially girls, dropped out of school during that time. A recent report from Kabarole district from January to June indicates that a total of 702 girls got pregnant. These girls are aged between the ages of 15 and 17.
According to our data, we have sub-counties which have high percentage of pregnancy among adolescents, among which Halgongo is the heads of the sub-counties. Halgongo has, out of the mothers who come, 28% are teenagers, which is at a high risk. And then Halgongo is followed by Kabarole with a percentage of 24%. And Kasenda sub-county shares with Kasenda shares with Kabende with 23%. And in the health center by the sub-county is Mugusu sub-county with also 23%.
Rutete sub-county registered the highest number of teenage pregnancies, which were 93 cases, followed by Harugongo sub-county registering 88 cases. Kichwamba sub-county comes in third position with 78 cases of teenage pregnancy, while Kasenda registered 67 cases in the same period. Annah Tukahirwa says failure to have safer spaces for adolescents at health facilities and the long distances to those facilities have greatly contributed to these high numbers of teenage pregnancies.
We have distance from the facilities to get sexual fertility services, like family planning. In our facilities, like 55% of our facilities lack safe space for adolescents, which may also hinder that. Then another challenge is parents have neglected their teenagers. They don't do education talk to them, they don't guide them, so they just move as how they want.
The same records from Kabarole district also indicate that from July 2021 to September 2022, 2,271 teenage pregnancies were recorded in the district among girls between 15 to 19, and 31 pregnancies of these were for girls under 15 years. Tukahirwa also says that other factors like gender violence and poverty have done more to catalyze the problem in the district.
It's gender-based in families. Other factors also include drug abuse, substance abuse within the families and within the adolescents. Then others, poverty, etc.
To solve this problem, Kabarole District and Fort Portal Tourism City, in conjunction with Sexual Reproductive Health and Rights Alliance Uganda, have launched a one-week campaign aimed at providing health talks in selected schools, health facilities and sub-counties. Margaret Nyombi, the program manager at Sexual Reproductive Health and Rights Alliance Uganda, says the youth often face challenges due to absence of youth-friendly services at health facilities.
They have already identified for us health facilities and sub-counties with high numbers of teenage pregnancies, and also schools which are grappling with sexually transmitted infections. So we go there with the health workers, we are going there with the peer educators who are trained to reach out to their fellow young people.
The teachers in school to give age-appropriate information to the very many young people, so that you can do away with the raging numbers of teenage pregnancies, of school dropouts. Because when a girl gets pregnant, obviously she's going to take 2 years leave because she's pregnant, she has to breastfeed, the child has to have a little bit of independence before they go back to school.
This is Church of Uganda Family TV.